Hi, I'm going to be performing your comprehensive physical examination today. How you doing today? I see. I hope by the time we are finished with this examination, you feel even just the littlest bit better. So I'd like to ask you just a couple of confirmation questions, if you don't mind. I could just have your name and date of birth. And is that your preferred name? And how do you like to be addressed? There we go. This comprehensive physical examination involves quite a few different tests, as the name would suggest. We are going to be looking, for example, at your scalp, at your eyes. We've got our Snellen chart back here that we will get into in a little bit. I have the Ophthalmoscope, the Otoscope. We've got some reflexes to check. We are going to have quite a few little fun things for you today. So, to begin our examination, I'd just like to ask permission if it's all right to touch you. Wonderful. Thank you. So we are going to start with the scalp. We are going to take a look at the head. We'll move on to the face, but I want to begin right in here. Would you mind telling me if you've had any issues as of late with your scalp? I know we're getting into the warm season, so sometimes our scalp chemistry changes a little, but anything out of the ordinary for you? Just looking at the hairline here. Yeah, let's look around the ear. No changes, that's good. That's good. And we'll come around to the other ear. Good. And I'm going to get a little closer here. And I'm actually just going to take a peek behind the ears, if you don't mind. Okay, so just going to take a little look here. So this is a common place for skin conditions and lesions to hide, because we can't exactly see it ourselves. We're not going to be able to catch things very quickly if we don't have a way to see them. So that's where I come in here. And I'll take a little look here. Good. So the root of the ear and the back of the cartilage are all clear here, which is good. So let's move on, and we'll work more towards the posterior head. How's your week been going? Yes, it was absolutely gorgeous, and then all of a sudden it got quite warm, yeah? That's the thing about Iowa, and Midwest in general. If you're not happy with the weather, just wait. 4 seasons in a day. Good. There. Now, let's go ahead and just take a little look at your face. So, are there any issues, any conditions that you have any concerns with on the face? For example, you might be experiencing some skin sensitivity or persistent redness you might not have dealt with before. Maybe there's an itchy spot or a dry, flaky spot that doesn't seem to go away. Maybe there's a new freckle or mole. Anything like that? Just feeling the texture of the skin. Down the nose. No, okay. Good to know. Here we go. The texture has been even throughout your skin. It's not reddening up where I touch it. It's not overreacting. Which is good. And I'm not seeing any spots that I would be concerned with either. It all looks gorgeous. Excellent. So I'm going to run through your lymph nodes real quick. We are going to start at the posterior head with the occipital nodes. Then we're going to bring that behind the ears to the postauricular area. In front of the ears to the preauricular nodes. We'll go down the neck. We have anterior cervical, deep cervical chain, and posterior cervical. And then we'll finish at supraclavicular above the clavicle. So let me have a little feel here. There we go. Now, despite the heat, it's been a little noisy today, hasn't it? I've noticed that. It's interesting how some days, the same activities, usual suspects, the sound just carries a little different. And you know what I forgot to mention? We, of course, need to get the submental and submandibular nodes underneath the jaw. That's a very important spot. It's also kind of an odd spot if you do have some distension in the nodes. It feels like you have a pea under the skin or like a little bead right on the jaw. Good. And then we'll come down the neck. But I've kind of enjoyed the noise a little bit, to be honest. It makes everything just sound fuller. There's people out enjoying their lives, and you're just kind of hanging out and being a part of it too. Then we'll come to supraclavicular. Good. So, no distension that I can find, which is good. You haven't been fighting off any sort of infection-like symptoms or any infections recently. Okay, very good. So let's go ahead and take a peek at your sinuses. So we are going to press and tap, tap, tap all along the frontal, ethmoid, and maxillary sinus cavities, so named for the bone area there around. So I'm going to press in, starting with the forehead. Let me know if there's any pain or tenderness, right? Wonderful. So we're going to press, release, press, release, press, release, just like that. Good. How does that feel? Press, release. And now along the maxillary cavity. How was that? Very good. So now I am going to do some direct percussion, meaning that I am going to be directly tapping over the sinus cavity areas. Let me know if this is painful or tender. Just going to good. And the maxillary side. How was that? Good. So let's take a break for just a moment while I jot some notes down. Now, I would like to test a couple of the superficial muscles of mastication, which is kind of a long way of saying I'm going to assess the masseter and temporalis muscles right in here. So if I could just have you clench the jaw, unclench, clench, and unclench. Good. And up here, clench, unclench, clench, and unclench. Good. Was there any pain or tenderness with any of that? No. Good. So we are going to test cranial nerve number 5. This is the trigeminal nerve, and the Cranial nerve number 5 actually has sensory and motor functions. The motor was partially with the muscles of mastication, but now we're going to test the sensory aspect. So, in my buck hammer here, a little pointed tip here, and in the bottom we have a tricky little brush there. So I am just going to have you tell me whether you feel the softer brush or the sharp pointed tip. Just going to test these on your jaw real quick so you know what those feel like. This is the soft. Good. And this is the sharp. Just like that. Yeah, it's not going to break the skin at all. Doesn't hurt. Just feels like a pointed point of contact. If I could just have you close your eyes. No peeking. And tell me whether you feel the soft or the sharp touch. Sharp. Soft. Sharp. Sharp. Soft. Soft. Sharp. Soft. 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 Sharp. Sharp. Soft. Very good. So I'm going to put these back. And then we are going to test another cranial nerve. That would be cranial nerve number 7, the facial nerve. Just pop this right back in. Go. Very handy. So to test cranial nerve number 7, I am going to have you make some expressions for me. So firstly, if you could just raise your eyebrows. Very good. And if you could squeeze your eyes tightly. Okay. I'm going to try to open your eyes. I want you to resist me. Keep your eyes nice and shut. Good. And you can open them. If you could widen the eyes. Excellent. If you could puff out the cheeks. Good. If you could smile real big, showing the teeth. And if you could frown for me. It's a little difficult to try to do on command. Yes. Okay, very good. So, we are going to be moving on to the eyes. I would like to have a little closer look at your eyes if you don't mind. Okay, so let me take a look here at each. So we want to note that the eyelashes are intact, that the eyebrows are intact. Looking at tear ducts, and let's take a peek at the conjunctiva. I'm going to pull up on the eyelid, I'd like you to look down. Up, you look down, 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 down. Good, and I'm going to pull down on the eyelid. I'd like you to look up. Look up. Good. Very good. All the tissues look healthy. Sclera looks clear. Pupils are round. Let's take a closer look at those pupils. So, if you could just look at my nose here, I'd like to look at the pupillary response of the eye. So we want the pupils to be equal, round, and reactive to the light. Good. Just keep looking at my nose. Good. Just keep looking at my nose. Excellent. So, while I've got the light, I am going to perform the direct consensual response test. I'm going to put my hand right here between your eyes. Just going to bring the light here, and I'm looking for the pupil to react to the light. That's our direct response. Good. And when I shine the light in this eye, the other eye should react in the same way, even though the light's being blocked. That is our consensual response. Consensual. 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 Good. We'll switch. Direct. 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 Good. And consensual. 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 Very good. Let's put that away for the moment. I want to look at your eye movements. This is governed by cranial nerves 3, 4, and 6. So if I could just have you look up for me. Look up. Good. And if I could have you look down. Look down. Good. Look up. And look down. There you go. Look up. And look down. Good. And if you could look to the side here. Good. And to the other side. Look to this side. And the other side. Good. If you look up in the corner here. Good. And down here. And look up in the corner here. And look down here. Good. And back up here. Back down here. Back up here. And back down here. Good. And if you could follow this finger as it comes in and out. In and out. In and out. Switch to the side. Just follow my finger as it comes in and out. In and out. In and out. Wonderful. So let's take a peek at the Snellen chart back here. We're going to test your visual acuity, give you a break from all the looking around. I am going to have you read the letter that I point to with my indicator here. Just do the best that you can, and we'll start right up here with the very first letter. What is this letter right here? Good. How about right here? What's this letter? Right here. Good. Now in the 20 over 140 row, what do we have here? Here. Good. And here. Excellent. What about row number 4? Let's go backwards here. What is this letter? Here. Good. Here. Yep. And right here. And row 5. What is this letter? Here. Good. And here. And how about this one? And right here. Good. Now in the 20 over 50 row, right here. Good. Here. Right here. Yep. Here. Good. Here. And here. Excellent. We'll readjust a little. What about this letter right here? Okay, and here. Right here. Good. And what about this one? Excellent. This one. Good. What about right here? Here. Okay, good. And in the 8th row here, right in here, let's go backwards. Right here. Good. Yep. Right here. Good. Here. Yep. Yep. Good. So now the 20 over 25 right in here. Can you read this one? Good. Good. Excellent. Yep. Wonderful. Brilliant. Gorgeous. Yes, very good. Now, we're going to do the 10th line here. If you could just read me this letter. Right here. Good, right here. Excellent. Right here. Good. Here. Yep. And just for funsies here, just for fun, can you read row 11? 20 over 10. Right here. Good. Yep. Good. Good. Yep. All right. Excellent. Now we're going to finish off the eyes with a test called the Fundoscopy. Now this means that I will be looking with the ophthalmoscope here at the fundus, or the back of the eye. And I can do that just with this little scope and some light. So I am going to put my hand on top of your head, just so that I'm not going to run into you. And I'm going to come in at an angle, looking for the red light reflex here. And then I'm going to come in real close so that we can look at the back of the eye. So here's where I can see the optic disc. That's where the optic nerve will go back to the brain. And that gives your brain the information from your eyes. It's an afferent nerve. Good. I'm going to come back here. And we'll do that on the other side. We have the optic disc, and you can also look at the little blood vessels. Maybe pick out the macula as well. Good. Just looking on the health here of the fundus of the eye. The eye is an incredibly fascinating sensory organ. And I think we take for granted how wonderful our anatomy can be. Good. Bring that back. Very good. So, I am going to switch out the heads. And we are just going to bring the otoscope into play instead. Good, and then we're going to get a new speculum that just snaps on, just like that. So, I would like to take a little look at your ears, if you don't mind. Okay? Just going to have a little overview of the ear. So, the cartilaginous part of the ear here, this is called the auricle, or the pinna. And you have quite a few folds in there, right? And their function is to funnel the sound into the external auditory meatus here, or the ear canal. Good. And is any of this palpation uncomfortable? Good. So we've looked at the back of the ear, and the rest of the ear here looks good. Let's take a peek at the other one. So right in here we have the tragus. It's that little fleshy bit right in front of the ear. We have the lobe coming up to the helix, our big rounded part. Antihelix opposite of that. We have the concha, which is our bowl of the ear. And we have the antitragus, which is opposite of the tragus. And of course we have the ear canal, which I'll be taking a look at in just a second. Good. Let's take a peek inside the ear. So I'll be looking at what is technically the middle ear. The inner ear has, for example, your stapes, incus, and malleus, but your middle ear is your ear canal and your tympanic membrane. I'm going to take a little look. And clear back. And let's have a little peek into the ear. This ear, we have the ear canal. I need to check for blockage, redness, irritation, scratches, things like that. The little hairs inside, and look at the cerumen that helps the ear clean itself. Also take a little look at the tympanic membrane here. Good. Is any of this painful at all? Very good. And have you been having any issues with the ears? Whether it's itching, a feeling of fullness, maybe any discharge, things of that nature. Okay, and how about your hearing? How's that been? Good. Okay, so let me take a look at the other ear. So on the side, we are going to be looking at all the little structures, little tissues in the ear. But while we focused on the ear canal, now we can chat a little bit about the tympanic membrane, most notably that it is a pearly gray color. It is semi-transparent, and there should be no perforation or any bulging in the membrane. And I should be able to see the tip of the malleus in the inner part of the ear through the tympanic membrane. There's also a phenomenon known as the conable light, in which I should see a reflection of the otoscope's light. Good. Now, I would just like to do a basic hearing test with you. I know you said your hearing was not affected, but I just want to make sure. So I'm going to be whispering some words in one ear or the other. I'd just like you to repeat what word you hear. Basic. Good. Saline. Pencil. Good. Sandal. Paper. Rope. Scarf. Good. Curtain. Leaf. Chair. Table. Mirror. Shelf. Binder. Notebook. Marker. Filigree. So it seems that all of those came in loud and clear. Wonderful. So let me just... Good. Now we're going to move on to the nose, mouth, and throat. We'll also assess cranial nerve number 12. So if I could have you tip up your head for a moment, I'd like to take a look inside the nasal passages. Have you had any issue with breathing through the nose or with your sense of smell? No? Good. That's good. Just taking a peek, looking at the tissues. We want them to be pink and moist with the septum in midline and no perforation. And if I could have you open your mouth. Good. Let's take a look. Tongue depressor, and we'll take a look at the inside of the buccal mucosa, for example. We'll look at the teeth. Good. Inside the cheek there. There we go. Good, and the tongue, if you could lift that to the roof of your mouth. Good. Good, that looks clear. You can lay that back down. And now if you could stick out your tongue as far as you can and flatten it. Just going to come in with my depressor here. We're going to look at the back of the throat. So, we're also going to test the glossopharyngeal and the vagus cranial nerves. If I could have you just say, ah. Good. Let's take a look at the throat. The tissues look clear there. No issues with the tonsils. Do you have your tonsils intact? I see. Good. And if I could have you stick out your tongue for me, for the hypoglossal nerve, you could lift your tongue up and move it down, move it to the side, and the other side. Good, you can put your tongue back in your mouth, and if you could swallow. Just want to test the function of your throat there. And just try to take a dry swallow. I know it's a little difficult. Just yeah, trying to do that feels a little uncomfortable, huh? Yes. Okay, very good. So write that down, and then we're gonna take a look at the neck here. I'm going to grab my stethoscope. We're going to start by auscultating for bruits. B-R-U-I-T-S. And this is an audible heart murmur. I'm going to put my stethoscope, the diaphragm here, on the carotid artery. And I'm going to have you take a deep breath in and hold it. That way I won't hear the sound of your breathing, but I'll be able to isolate any possible blood flow issues in the carotid. So if I could have you Deep breath in. And hold. Yeah, on the other side. Deep breath in. Hold. Yeah, let it go. Good. So I'm just going to put this here for a moment, and I'm going to palpate the carotid. It's very light here, but I want to assess the strength of the pulse. Good. Okay, let me take a little look at the neck. And we'll take a peek at the thyroid as well. Okay, so I'm going to palpate the trachea and make sure that is midline. Good. I'm going to have my fingers right here. If I could have you take another dry swallow. Just want to feel around the thyroid here. Yeah, take your time. I know it's hard to do multiple dry swallows. There we go. Okay, that looked all good. Now we are going to do a little bit of palpation and percussion on the chest before I bring this bad boy back out. So I am going to palpate firstly the apex beat of the heart. This is going to be the mid-clavicular line, right in the middle of the clavicle. If I match that with the fifth intercostal space, which are the spaces between your ribs, those muscles in there. If I go 1, 2, 4, 5, and match those two up, that's about where I should have the apex beat. I'm going to feel that for a moment. Good. Good. Okay. And then I am going to do a little bit of percussion. So this is an indirect method of percussion. I'm going to be putting my hand on your chest, and I'm going to be tapping on my fingers and listening for the sound that comes back out of your chest, whether it's resonant, hyperresonant, dullness, or has a stony dullness to it. So I'm going to put my hand on your chest and just tap away. Here to the other side. Good. Good. If I could have you lift your arms up. There we go. There, excellent. So now let's bring the stethoscope back in. And I'm going to listen to your heart first. You don't have to breathe in any special way. I'm going to start at the top here at the aortic area. We're going to go around the chest, in the pulmonary area, the tricuspid, Now for the lungs, I'm going to put the diaphragm in different positions on the chest, and I'll have you take a deep breath in and out. We can listen for crackling, wheezing, other sorts of abnormal noises. You take a deep breath in and out. 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 You could lift your arms again. Good. Deep breath in and out. Deep breath in and out. There we go. Now I'm going to jump right into auscultating the abdomen. We want to do that first because it's almost like if you have a clear lake, right? As soon as you step in that water, it's going to mix everything up. It's not going to be like it was before. It's kind of how it is. If I start pressing down and tapping around, I'm not going to get the same sounds as I would have if I hadn't done that. So, I'm going to have you breathe normally here. And this is going to be much quicker in that I'm taking a couple seconds to listen, though we have quite a few different areas to cover. Put this away. And then I'm going to do some percussion here with the tapping on my hand. We're going to listen for the sounds that come back. Following the borders. You can hear we're over an organ. If an area has fluid, or if it's hollow. I'm going to do some palpation here. So if I could have you just breathe normally, and let me know if any of this is painful or tender. We'll start with one hand. And then I'm going to go in with two. I'm going to have you do your best to just breathe through this one. This one tends to be more uncomfortable. Good. So, we are going to move on to the upper and lower extremities. We will test your reflexes and do a little spinal examination, and last one's going to be gait and coordination. So, if I could see your hands, please. Good, just palms facing the floor. I'm going to take a little peek, and I'm going to test the temperature using the backs of my hands. Go hands up the arms. Make sure the joints are not super hot or that the skin's not clammy, cold even. Good. And you take a peek at the nails here. Oh, we're looking for the condition of the nails, if there are any nodules or maybe cholesterol deposits around the nails, staining, that sort of thing. Looking at the color. I'm going to press down on each of your nails. We're going to test the capillary refill, which tells me how your circulation is doing. It should blanch the skin, and then when I pull off, the color should return in less than 2 seconds. There we go. So I am going to palpate each joint, distally to proximally. Let me know if any of this is painful. Have you had any problems with your joints? Pain, swelling, heat? Very good. And is any of this painful or tender? No, very good. Now, if I could have you flip your hands over, I'm going to assess the pulse in your radial arteries for a moment. Good. It's nice and relaxed now. Been here for a bit. The room's quite cool compared to the outside. Some nice atmosphere. Good company too. Good. Now I'm going to look at the surface of the hand. Look at the palms, the thenar and hypothenar muscles. And look for example, palmar thickening, skin abnormalities. Good. Good. So let's do a little bit of range of movement testing. Probably going to get a lot of joint cracking and creaking. So if I could have you close your hands into a fist and open the hand. Good. You could make a tabletop with the hand and curl the fingers over the palm. Good. And can you move your wrists down? Up, down, up. Good. In and out. and if you could rotate them back and forth. Good. Now, if I could have you lift your arms up to the sides and all the way above your head, backs of the hands touching. Good. If you could bring them all the way forward as high as they can go, and all the way back, as far back as they can go. Good. Can you put your arms up like this so the elbow is at a 90-degree angle? Good. I'm going to try to push you. I want you to resist me. Good. And I'm going to try to pull you, and I want you to resist me. Very good. Now, if I could have you just hold your upper arms at your sides with your elbow making a 90-degree angle again, and move your elbows in and out. Okay, but at your sides. There we go. Very good. Okay. And can you shrug your shoulders for me? Just a few shrugs. Okay, so our cranial nerve number 11 looks good there. Let's take a little peek at the lower extremities. So, we're going to look at the legs. Usually what we notice here, upon inspection, the shins can get some goofiness happening. And we'll look at the feet, check the capillary refill. So, temperature feels good. If you had any problems with any of the joints in the lower extremities. Very good. Okay. So, let's take a peek at your feet here. Good. Nails look good. And I am just going to press down on each of the nails and look at the capillary refill. Good. And then I'm just going to feel our post-tib pulses here. Then we'll move to dorsalis pedis. Right there. Nice and strong. Good. Good. Okay. So, let's go ahead and do a little range of movement here. So, if I could have you lift the thighs up. Good. Can you rotate the legs at the hip? Might have to do it one at a time. Just get a little rotation and back. Good. Okay. Can you kick out the lower legs and bend at the knee? Good. And can you move the feet up and down? In and out. And roll them back and forth. There we go. Excellent. Let me bring out the reflex hammer. We'll work our way back up. So, as I said before, this is the buck hammer. That's what this kind is called. So, I'm going to take your foot here. I'm going to have you let this relax. I'm going to be tapping behind your ankle on the Achilles tendon here. Right? Just let the foot relax. There we go. Okay, let's try that again. There, that's better. Feels a little weird, doesn't it? Yes. Oh, and the other foot here. I'm going to hold it up a bit to get a little bit of tension on the tendon. And if I could have you just let everything go slack. Good, and Good. Now the knee jerk is pretty easy. Just have you relax the legs. Okay. Let them go floppy. There we go. And good. Get a few little kicks in there. Good. So now we'll move to the arms. I'm going to do the triceps and biceps reflexes. If I could have you just rest the arm over the thigh. Good. And let it just hang down. Let everything go loose. Good. And I'm going to tap along the back of the elbow here. Just keep the arm relaxed. There we go. Get a couple of misses in there, huh? Now the other side. Lay the arm across the thigh. Let everything go loose and floppy. There we go. And then, there we go. Perfect on each tap. Now for the biceps reflex. I'm going to put my thumb in the crook of the elbow, and I'm going to tap on my thumb. I'm just going to hold your arm, wrap my fingers around the elbow, and tap. There we go. Good. The other side. Wrapping my fingers around the elbow, thumb in the crook of the elbow. Good. There we go. Now, we are going to do a little spinal examination, and for the gait and coordination, both of these I'm going to have you standing, okay? So if you could stand up and turn around for me, I'm going to have you bend down as far as you can. I'm going to have you very slowly come back up, okay? So bend down as far as you can, as far as comfortable. And I am going to have you very slowly, vertebra by vertebra, come back up. And I'm going to palpate along as you're doing this. Okay, good. And then to test your gait and coordination, I am going to have you walk to the end of the room, just normally. And then if I could have you come back walking on your toes. Good. And if you want to go back walking on your heels. And if you want to come back, this is called tandem walking, where you're going heel to toe. Touching heel to toe with every step. Sometimes they try to have drunk people do this test. Good. Good. That looks good. Did that feel wobbly at all? Any of those different walks? Very good. So, go ahead and sit down. And I'm just going to write up your final notes. Do you have any questions for me? I am confident that your health is in the most perfect state that we could achieve, and everything looks excellent. So, if you don't have any more questions, I'm going to sign off here. And that'll be it. I'd like to thank you so much for coming in for this comprehensive physical examination. I hope you have a whale of a day and a good rest of your night. Thank you.
Thank you so much for watching. I really appreciate it. If you enjoyed this video, it would greatly help me out if you clicked the like button and left a comment so YouTube's algorithm registers that it was a good video. If you want to see more of my work, consider subscribing to the channel. I create primarily medical, pseudoscience / alternative medicine, and personal attention ASMR roleplays. But I've done a little bit of everything from historical to sci-fi to fantasy. If you'd like to support the channel, I offer ad-free videos, early access on videos, and exclusive content